Hemoglobin is the main functional substance in our red blood cells. It is a protein, meaning it is made up of a string of amino acids, and it also contains an atom of iron, giving our blood its red color. The main job of hemoglobin and our red blood cells is to deliver oxygen from the lungs to other tissues and organs in our bodies that will use it. Hemoglobin A is the most common type of hemoglobin found in adults, but there are other forms. For example, fetal hemoglobin is called hemoglobin F and is normally present in a fetus and newborn. Or people with sickle cell disease have hemoglobin S. It is important to know that individual red blood cells last about 120 days in our circulation before their function declines and they are removed. During the lifespan of a red blood cell, the hemoglobin molecules inside accumulate a form of modification called glycation. Glycation is the unregulated attachment of a sugar molecule, glucose, to amino acids in a protein. For hemoglobin, there are some chemically preferred spots where the glucose can attach, and the most commonly formed glycated hemoglobin is known as hemoglobin A1C. The more glucose that is available to react, the more hemoglobin A1C will form. In people with diabetes, their ability to remove glucose from the blood is impaired, leading to higher concentrations of blood glucose. Since there is more glucose available for glycation, people with diabetes generate more hemoglobin A1C during the lifespan of a red blood cell versus people who do not have diabetes. So, measuring the amount of hemoglobin A1C, typically expressed in the US as a percentage of all hemoglobin, gives an indication of the long-term amount of glucose in the patient's blood during the lifespan of their red cells. In other tissues of the body, the same type of glycation is happening on other proteins, leading to various types of damage. The damage elsewhere results in common complications found in diabetes, such as kidney disease and visual problems like retinopathy. Years ago, several large studies showed that by controlling the amount of glucose and limiting the amount of glycation damage, the onset of these complications could be delayed or prevented. A1C could be used to determine how well the glucose was being managed. A1C became a surrogate or proxy for the amount of damage taking place in other tissues, and groups such as the American Diabetes Association were now able to make recommendations to doctors and patients about A1C treatment goals for adequately controlling diabetes and improving quality of life. In addition, the test is now also used to diagnose diabetes, which is often viewed as an improvement over historical tests of glucose tolerance. But A1C is not the right test for everyone. Since the test is a substitute for measuring how well someone is able to control their glucose, there are conditions in which A1C does not really indicate this. For example, normal A1C values are based on red blood cells circulating for a typical period of about 120 days. In some people, their red cells don't last that long due to things like anemia or sickle cell disease, so their cells don't accumulate the same amount of glycation they would if they lasted longer, and their percentage A1C may not really show how poor their glucose control is. Or in patients who have received blood transfusions, their A1C will indicate the glucose control in the blood donor until those cells are removed from circulation. This is good to keep in mind. A1C is a great test for most people, but it is not a good indicator of glucose control in everyone.